Hello and welcome to this video. In this video, we are going to ask one of the burning questions one of the dentists asked me, which articulator should I buy? I'm now in this full mouth reconstruction journey. He's doing my course and he's enthusiastic and he really wants to get into doing full mouth reconstruction and he wants to buy articulator. And he asked me, which articulator should I buy? And this is the question many dentists ask. So I thought I'll make a video to give you my opinion. There is no right or wrong opinion about this, but to give you my opinion as to what I think you should buy when you're starting out doing full mouth reconstruction. So we have three different types of articulator. On the far left, we have fully adjustable articulator. On the middle, we have semi-adjustable articulator. On the right side, we have a set value articulator where the values are set. On the left side, the fully adjustable articulator, I feel that it's over the top in the sense that, when you're starting your full mouth reconstruction journey, you're really definitely not going to go into that realm because it's time consuming, it's more expensive, it needs very much expertise in order to set all these settings. And you need a kinematic face so many times, you need that readings to transfer into patient's mouth, from the patient's mouth to the articulator. So I wouldn't recommend fully adjustable articulator. That leaves us between semi-adjustable articulator and set value articulator or average value articulator. Average value are being 25-degree condylar inclination, 0-degree side shift, 7-degree progressive side shift. So 0-degree immediate side shift and 7-degree progressive side shift. I have semi-adjustable articulator. And if money is not an issue, then yes, you can buy semi-adjustable articulator. However, you need to make sure every time you do mounting, you're checking the screws, making sure all the angulations are fine, because the more you use them, the screws tend to become sometimes loose, and your inclination starts changing. And if you don't pay attention, you might mount model in the wrong inclination. And that's why if you're just starting on the journey, then I usually recommend average value articulator, because most of the time you're not going to change. Even if you buy semi-adjustable articulator, you're not going to change the setting of the semi-adjustable articulator. And if you are reaching at the stage where you're taking cross bites and you're taking the bite checks and bite records and changing the settings, then you usually on a higher level of full mouth reconstruction journey, and one articulator is not enough and you need more than one articulator. And in that case, yes, if you have a average value, you can buy semi-adjustable articulator. So in my opinion, if you haven't done any mounting, if you haven't started the journey, to make your life simple, buy average value articulator. And once you go into the journey and now you're doing multiple cases, then buy one more articulator, which is semi-adjustable articulator. Then you have a best of both worlds. And yes, if you then go on to become the master of the full mouth reconstruction, then you may want to buy fully adjustable articulator. Having said that, the digital world has moved along so much that we may all be mounting models digitally in future. Now, the other question I get asked is, what if my technician doesn't have the same articulator as I do? And it's a good question. Having said that, I am quite particular. So if I am mounting models and I want my technician to do the wax up, I'll send models and my articulator to technician, because although, let's say your technician has average value articulator, you have average value articulator, even if you swap models, they might not fit exactly the same on your model as on your technician's model articulator, because the technician articulator may not be calibrated, may have some issues, and if your models does not fit very well on your articulator, you won't know whether the issue was with the mounting, your bite records, or your articulator. So if I'm mounting model on my articulator, I'm sending my model's articulator to the technician. If technician has mounted the models, I'm asking technician to send me articulator models so I can assess on their articulator how did they mounted models, because having articulated models on the hands are just useless because you can't really assess it. Yes, technician used it, but you can't assess whether they've done what you asked them to do. So this is my advice. If you have any questions, please feel free to contact me.